You guys can start whenever you want to.
Okay. Hi, Stone Oak Bobcats. My name's Dr. Leighton. I'm a veterinarian. A veterinarian is a doctor who takes care of animals like Lola here. Lola is my dog. She's a golden retriever. Can you raise your hand if you have a pet at home? A pet would be something like Lola, like a dog or a cat. If you have a turtle or a guinea pig or a hamster, that's a pet too. A pet is an animal that relies on you to take care of them because they can't take care of themselves. So that's a really big responsibility, right? A really big part of taking care of your pet is making sure that you go to the veterinarian twice a year for their examination. I'm going to show you how to do an examination on Lola. Lola's a little nervous, so she's a little wiggly today. Whenever I start an exam, I start at the front of the pet and I work my way back. So we look at Lola's teeth. Oh, big teeth. We're looking to make sure there aren't any infected or broken teeth. I check her gums, make sure they're that nice pretty pink color. I can also tell if Lola's dehydrated just from feeling her mouth. So that all feels good. Good job, Lola. Next, what I'm going to do is use this instrument. It's called an otoscope. It has a little magnifying glass on the end and it shines a light down that cone. What I can do with this is I can look down in Lola's ears. So I'm going to look down in there. I can see all the way to Lola's eardrum. Oh, does that smell like your ear? Yeah. I'm going to check the other side. Come on, Lola Bear. Let's look in this ear. Got to check. There's 2 ears. And that one looks good too. What I'm looking to do is see if there's any redness or debris or if her ears are stinky. That would indicate that she has an ear infection and we might need to send her home with medication. So then I'm going to use something called an ophthalmoscope. This guy has got a light on the end and I look through here. And what this allows me to do is see to the back of Lola's eye. It reflects in the back there. It makes it a nice shiny yellow color. And I'm looking for any abnormalities in her eyes, making sure they're not red, that she's not squinting, there's no discharge, so Lola's eyes look great today. And then what I do, dogs have lymph nodes just like you. We can feel them under her chin, you can feel them, they're all over her body. You can feel them by her shoulders here, she thinks she's getting a nice massage. You can feel them in the backs of her legs. So if her lymph nodes feel good, if her lymph nodes were enlarged, that could mean that she's sick. Okay guys, so now I'm going to use my stethoscope. These go in my ears. I'm going to listen to Lola's heart and her lungs. I'm going to listen to both sides. Good job, Lola. So what I'm listening to when I listen to her heart, when your heart beats, it should make a nice normal lub-dub sound. So lub-dub, lub-dub, when it beats. If I heard any whooshing noises, or if I heard lub-dub-dub-dub, that would be an abnormal heart rate or heart rhythm, and that might be something we need to look more into. I also listen to her lungs. I make sure I'm not hearing any crackling or any wheezing. That might indicate that she has a lung infection. That sounds really good. And then I'm going to come and I'm going to give Lola a little bit of a tummy rub. When I do that, I can feel all kinds of things in there. I can feel her bladder, I can feel her kidneys, I can feel her liver, her spleen, and her intestines. Dogs can't tell us if something is bothering them, so this helps me know if anything is painful, and it helps me know if anything is abnormal or enlarged. Maybe we need to look into that a little bit further if something was bothering her. So the last thing I do is look at Lola's coat. I check to make sure she doesn't have any bumps or lumps. I look for cuts or scratches. We also check to make sure we're not seeing any parasites like fleas or ticks. Those can cause lots of diseases that can make these guys really sick. So I check to make sure I'm not seeing anything like that. Some other things that your vet might do when you bring them to the examination would be vaccines or shots, kind of like you have when you go to your doctor. Pets need those as well to keep them nice and healthy, so they need those almost every year. We also would want you guys to have your dogs on heartworm prevention. Heartworm's really common where you live in Texas. It's carried by mosquitoes, and dogs need a special pill that they take every month to make sure that they don't pick that up. And then you might have noticed your mom or dad, sometimes they'll put like an oily drop between the shoulder blades. That is a flea and tick prevention that's recommended as well, to make sure that Lola didn't get any fleas or ticks, because those are gross. So if Lola was sick, we might have to check blood samples. Sometimes we have to check urine samples or do an x-ray to see into her insides to try to figure out what's wrong with her and help her feel better. So as you can see, having a pet's a really big responsibility. So make sure that you are always gentle with your pet, and most importantly, make sure that you give it lots of love. Bye, Stomach Bobcats. I know I'm making a weird face.